Welcome to the teleconference session of PGDMC's program. This is the second PGDMC's teleconference of this year. In our previous session, we had discussed about the adolescent health in details, and we had seen how to communicate with the adolescents in detail. Today, we will have 3 sessions. In the first session, we will discuss about clinico-social case study. In the second session, we will discuss how to undertake a project work, and in the third session we will discuss about adolescent sexuality. In these 3 sessions we will go in details about each topic. You have not received any material till now, so I will request you to listen to these sessions carefully, and when you get your letter from the program in charge of your respective centers, you will be able to know the exact date for the spell training, and by that time you will also receive the material and you can start your project work, you can start taking the other activities as planned. We will also send the program guide by that time, so that details of the program outline and the details of the material and other events, everything you will come to know by that time. If you have any other doubt, you can ask during the discussion session as and when the session proceeds. So the first session will be about socioclinical case study. To discuss this session, we have 2 experts with us. To my right, Professor Sunila Garg. She is professor at the Maulana Azad Medical College, Delhi, and she has been involved in our program as a course writer, and also she is a counselor for this program. To her right, Dr. Krishnan Anand. He is associate professor at All India Institute of Medical Sciences. He has been involved in writing the project guide and also editing some other materials. So you are fortunate to have both the experts here today. So I will request the students to utilize this opportunity and clear their doubts as and when they feel it. We have our toll-free numbers. Those who are viewing this program from their residence, they can ring and we will be able to answer your questions. Now I will request Dr. Sunila Garg. As you know, we are, as a part of the MME 201, we have clinico-social case study for our students. They have to undertake this while visiting the family. Some of this they will be doing in the medical college and some they will be doing in the workplace. Can you, madam, guide them that how they should carry out? Maybe you can brief them what is clinico-social case study and how to go about it.
Basically, thank you, Dr. Jaina. I would like to emphasize first that from this year we are calling it as Socio-Clinical Case Review. Basically, all of you are aware of that in the background or in the emergence of the disease, it is the social factors which play an important role in the occurrence of the disease. For example, let's say the family size. If there is an overcrowding in the family, that helps a lot in spreading the disease. Number 2, whatever is the literacy status of the parents. If the parents are literate, they will make use of the different healthcare facilities vis-a-vis if the parents are illiterate. What are the influencing factors on the family, whether it is the occupation, whether it is the income. So many factors are there you will see in emergence of any disease or their routine day-to-day practices which design or which influence the course of the disease. So that is where we have decided that we will pay a lot of attention to the social factors, because ultimately it is the social factors, if they are tackled upon, to a large extent, then basically that can influence the course of the disease, what we call it as the clinical spectrum of the disease. Now, if we look at the first this thing, I will give you the outline of the case, basically how to undertake a case, and let us have a look at the first slide. Basically, when you go for the case, now from your question will be from where to take the case. Now, this case you can take from near wherever you are staying, near your skill development center, and this case has to be worked in totality with respect to the social factors, with respect to the clinical factors. Now, basically you will see that ultimately we will also be giving a diagnosis which will be based on social factors as well as clinical factors. Now, as per the vis-a-vis, when you look at the case which is discussed in the hospital or the case which is discussed in the family, since we are looking in totality about the particular individual, so it is very important to obtain certain details about the individual. Now, first it is also given in detail in your practical guide. Now, let's look at what all factors or what all information is very important to be elicited when you are taking a case, or we call it a case. It may not necessarily be a case, it may be a individual who is not taken immunization, or maybe a case of tuberculosis, maybe any aspect you can imagine. So first, for any information about the individual, you require a name, you require where the individual is staying, because ultimately when we have lot of cases, it is important to look whether you see this problem is more in rural area, urban area, and also it is definitely important to identify individuals. So record the address of that particular individual in detail. Then it is very important to know who is the head of the family, because ultimately all these go in the recognition criteria. Now, down below is a column of a family, whether it is a nuclear family or a joint family. I am sure you would be aware of these two terms. What is a nuclear family? You would have read in your undergraduate days. To recapitulate, nuclear family is the one where it is husband, wife and unmarried children. Joint family is the one besides this. It can be a single generation joint family where husband, wife and their married children could be there. It could be two generations, that means which I have given you now, that is husband, wife and their married children. Three generation, that means children's children could be there. So that way you have to record anything besides, you see, husband, wife or unmarried children falls in the category of joint family. Then it is very important to have information about the religion and caste also, because now we are paying lot of attention to the families who are below poverty line and all that. So ultimately it is very important to look at, because the healthcare seeking behavior, their practices are influenced to a great extent by religion also. Now, so basically I'll like Dr. Anand to spell a bit and give little bit more importance to these demographic factors. Why do we take demographic factors while eliciting the clinical social or socio-clinical case review?
Thank you, ma'am. As we say that not only a good doctor not only treats the disease but also the individual and the family that they come from. And therefore, in order to treat anybody well, this is not necessarily only for public health or community medicine people. Any doctor, while treating a patient, should take into account the circumstances in the family and in the society from which the patient comes. While Madam talked about the determinants or the causes which lead to many diseases, there are also important consequences of disease at societal level. That also should be addressed. We not only need to know why disease, the different social determinants cause the disease, but also a disease itself leads to many social consequences. As we know, there are many diseases with social stigma, whether it is leprosy, tuberculosis, HIV, and also economic consequences of disease is very important. Not only because they might need treatment for a lifelong, or even for a short term they might require much more resources than they have. We know that one of the major causes of rural indebtedness is healthcare seeking expenditures, and therefore it is important to look at the economic as well as social consequences of disease as well. Now, coming to the question of why we study demographics. In demographics mainly we would primarily talk about age and sex. Again, if we start with sex, even though is a biological variable, but we know that in social context, sex means much more than just a biological or a physiological differences between males and females. It often results in a different role, whether it is in terms of healthcare seeking behavior, whether in terms of ready to spend on money on them, or the role that they perform within the family and its consequences for either a disease occurring or not occurring. So the gender plays a very important role in the occurrence of a disease and its consequences. Age is important because as soon as we know the age, we immediately link it up with some of the conditions which are common to that age group. For example, if you look at an elderly person above 60, 65 years, you would immediately like to know whether that person has problems which are related to that age, particularly let's say cataract, hypertension, joint pains. So whenever you have a person with an elderly in the family you have an elderly person, you need to look into these issues of an elderly, health related to elderly. Again, if there is an under 5 child, we would definitely like that you work up that under 5 child and at least look at the common diseases which are there in this age group, diarrhea, ARI. But more importantly, from preventive aspect, look at nutrition and immunization. Similarly, age group, third would be the eligible couple age group, 15 to 45 years. Again, immediately anybody in the wife or a female is in the 15 to 45 age group, would like to know their status regarding family planning. I think that would cover primarily. The other demographic features would be marital status and those kind of things. Those would be obviously used as and when it is required, depending upon the type of family that you are on, the case that you are going to work up. I think, ma'am, then.
Yeah, I think Dr. Anand has given a detailed outline. We will also provide you detailed outline about all these things in your test material, so you will be able to know. Madam, can you highlight when you are telling joint family, how to differentiate joint family from nuclear family, extended family, if you can?
Yeah, basically, you see, if it is, as I told at the beginning, that let's say there is a couple which is a married couple, simply it's a newly married couple, they are staying away from their parents and all that in a particular area, and that will be simply known as nuclear family. Now they give birth to a child and then the second child. So as I said, husband, wife and unmarried children together will be constituting a nuclear family. Now once basically these children, if you see basically there is a family where it is husband, wife and the brothers of husband, wife, and then exactly their children also are there, so basically that will constitute a joint family. Now that can be again varying up to how many generations are there, whether they are parents, their parents and their children. So it will constitute, that means grandparents, then parents and children. So that will constitute a 3-generation joint family. Basically why it is important to look into the details whether it's a nuclear family or it is a joint family, because ultimately the social support mechanisms do play a very important role. Because you see, if the child is sick and the child is not taken to the healthcare facility because both the parents are working, then it has a lot of difference. Again, wherever the social support systems are poor, that has got also a lot of implications on the case itself. So primarily the importance is to look at in what context the family is there, that means nuclear family or joint family or a extended family, basically where we see that, as I said, that the parents of the children are there and their, you see, brothers or sisters are there, and then accordingly, so it becomes, whenever you see of the same level, of the level of parents, then there you see brothers and their wives and all are there, so it becomes a extended family. So basically this kind of family information is very essential with regard to not only diseases but with regard to the social support mechanisms which are important, you see, not only with regard to healthcare seeking behavior but with regard to the determinants with you know, which are prevalent, or beliefs and practices within the family. Because you see, if there is only a nuclear family, then whatever beliefs are present within that particular area are going to play important role, because they are going to be based on whatever is the knowledge of the couple at that particular, you see, in that particular area, or whatever they have imbibed from the parents. But wherever the parents are there, then there you see beliefs, their practices, whatever their grandparents did, you see, with regard to that particular illness. Now let's say measles, people have their own beliefs, but if there are elderlies within the house, then they have got their own ways of thinking, so that plays a very important role in context of nuclear family or joint family.
Okay, thank you, madam. I think we can proceed that how to take the details of a index case.
That is given very well in your practical book. Yes. Now let's recapitulate and have a look at the slide primarily. Now if you will look at your folder, you will see that the next column talks about chief complaints. Now that means chief complaints with what the individual is currently suffering from. It may be a case of acute respiratory infection, that means the acute disease, acute diarrhea, where we will be discussing the details in depth. But chief complaints primarily means the first complaints which the person complains of. Now then you will talk about the details of present illness, that means since how long this, and that means in context of present illness only. If you take an example of diarrhea, that means you have to talk in that context only, primarily since how long the disease has been there. Now whether it was earlier, since how many days the loose motion started, what is the frequency of loose motions, along with that there is increase, you see, irritability which is present in the child. So you have to see whether it's a complaint which is present with regard to any disease at that particular moment in a child, in a elderly between, you see, over the age of 60 years, or between in a woman of the reproductive age between 15 to 45, in an adolescent also. Now let's say if there is an adolescent girl, she is suffering from menorrhagia, so that may become her chief complaint. So see, what comes to the mind uppermost is chief complaint. Then with regard to this, whatever are the relevant past illnesses, you have to record. Here I will tell, you see, basically you do not go haywire into whatever you see has been there since birth, you go on recording in past illnesses. You have to focus only on the relevant past illnesses. Then it becomes very important to record the history of personal history with regard to the habits, with regard to, you see, specifically, particularly if we are looking at alcoholic, then you know it is very important to have a look at that. If there are any habits with regard to smoking and all that, so these factors, they become very important. Here I will let Dr. Anand, you see, give you certain examples with regard to these four factors, that means chief complaints, present illness, past illness, and history of personal history.
Thank you, ma'am. Very often, as in the introduction, Dr. Garg said that you might be taking cases like malnutrition or even unimmunized children. Remember, they may not really have any chief complaints, because we know that malnourishment is almost unrecognized by most of the mothers, or like say severe anemia. So even though the format that you are using is what is typically used for a clinical case discussion, where a patient approaches you with a complaint and therefore you always have a complaint. In the setting that we are, it is possible that you might be approaching the family after identifying a case by some other methods. They may not really come to you with a chief complaint. Especially this is true for many of the diseases like anemia, malnutrition. Even if, in fact, pregnancy would not come with a complaint. It would be, though we often start off with saying that amenorrhea for so many weeks, it is not actually a complaint because they are happy about it, not really complaining about it. But still, whatever symptoms or the things which enables you to enter into the discussion with the case can be taken as a chief complaint. And you can always explain that it is not, if the malnourished case was not really appreciated by them, that the child is malnourished. You might say that even though they did not have a chief complaint, we have taken up this case. As long as you are able to explain it properly, that should be fine. Then is the details of these presenting illnesses. Once you take, they may have 1, 2, 3 or maybe more than 3 chief complaints. Then you go into each one of them and describe it in detail what those complaints are. For example, it was fever, you would go into the details for how long it has been there, what kind of fever, whether it was daily, intermittent, whether it used to go down, if yes, how was there a diurnal variation, was it associated with some other symptoms or symptoms which would enable you to zero in on some sort of a diagnosis. Those kind of details you will have to ask. Depending on each of the chief complaints, you will have to go into the details. If it was a case of loose motion, you would find out whether there was associated with vomiting, there was mucus, there were abdominal cramps, there was blood in the stools, was it associated with fever. So depending upon the chief complaint, you will ask relevant details of that chief complaint and present it as a part of your history. But also, as Dr. Garg said, we have a long list of questions to ask, and nobody expects that you will ask all those questions to all the cases. You need to be choosy, you need to choose based on relevance. But relevance could be both positive as well as negative. Very often we focus only on positively relevant, that if they are related, but there are sometimes good negative histories also which should be included while you are asking. We often tend to forget that. So remember also to ask questions related to things which are not there. Important things, not that you have to, there will be many things which will not be there. If there is a malnourished case, you need to also look at things, signs which are not there. Let's say vitamin E deficiency, or you have to look at other signs of vitamin deficiency in a case of malnourished, even if there is no complaint. And you have to make a statement even if these things are not present, so that people are, the examiner or the person is aware that you have asked these questions and have really looked for these signs or symptoms. So these are what I would say is important. In the personal history, again, first is that we relate to certain personal habits that people have in this. Number one, most for adults it would be things related to smoking, alcohol or tobacco use, those kind of histories. Those would what be the personal history. And in the past history, generally again we look at anything which could be relevant to the current illness, which could be there in the past, as in the case of a tuberculosis, or whether there was a past history of treatment for tuberculosis or a family history of tuberculosis for that matter. And also certain diseases which we should look for, which we generally say for diagnosis, for diabetes, for hypertension. But remember, unless many of these things are, that there is no history, does not mean that the disease was not there in the family. It might have remained undetected, especially if we are looking at an elderly generation. In past generations, there were very few ways that means that they could have been diagnosed in this population. Therefore, absence of that family history does not really imply that the disease was not present. I think that would be all.
Yeah. I think Dr. Anand has again given in details. What I want you to note, that these components like chief complaint, past history, present history, personal history, these you are doing at any rate with any case, even if it is in a hospital setup or in a community setup. So this part is almost common, but what is important, even if some complaints are not there, you have to elicit those complaints and you have to present while you are making the presentation, okay, that in the malnutrition, for example, vitamin deficiency was not there. So those observations you have to put, and the difference from the clinical presentations and the other aspect of the family presentation we will be discussing now one after another. Madam, can we now start with the family history?
Yeah. If you have once you receive the materials, you will see that next component of your socio-clinical case review will focus in detail about the family history. Now, what do you mean by family history? Now, let's have a look at the information which is required from the family history. Basically, you see, this is to be recorded. There is a table which would be given in your logbook. Now, this focuses upon all the family members. Now, the information is required with regard to the names of these family members, their age, their sex, the relationship with the head of the family, their marital status, whether they are married, unmarried, the literacy level, occupation levels, then income, addiction if any, and then present illness or past illness with regard to these members. Now, ultimately, what is the whole, you see, purpose of recording family history in detail? Now, you will see that this is given in the form of a table where we have information about all the family members, their age, their sex, their relation to the head of the family, their literacy status. So, in a glance, we can get the total information about that individual's family. How big is the family? How small is the family? If there are children, now is there any adequate spacing within the family? Then also we can definitely make out that if you look at, you see, with regard to that particular table, you can make out whatever is the basic occupation status of that family. And in nutshell, we also get a summary of primarily what is there with regard to, you see, present illness or past illness. Now, let's say if there is a history of tuberculosis within the family, if there are other members also, that information can be obtained. So, this is basically a gist. Now, second important information is we also want to focus about the economic aspects of the family. Now, this will primarily say, now this is only with regard to the family members, whether they are in nuclear family or joint family, wherever the income is pooled. So, when we record the total income of the family, particularly here in not most of the times what we have seen, you all come with only the income of the head of the family, but ultimately there may be elder son who is contributing to the income of the family, so total income of the family has got to be pooled and divided by the number of family members. This is where you see the income is shared, so that will give you per capita income. That means the income which is on an individual's name. Now also it is important to focus upon if there is a debt which has been taken by the family. Now sometimes you'll find that this information is not very relevant, but this speaks a lot about, you see, indirectly the family may be earning a lot or family may be earning sufficiently, but if there is a lot of debt on the family, that means lot of, you see, income package goes on spending on the loan which has to be paid back, and particularly in rural settings and wherever there are no formal loan facilities, there you see they end up paying lot of money with regard to, you see, whatever debt they have taken, and that will influence the socio-economic status of the family to a greater extent. Now Dr. Anand, you've got to focus upon, basically, you see, I'd like you to elaborate upon, you see, why in our context we focus a lot on the family history in particular.
Thank you, ma'am. As we said, the whole focus of this presentation is that individuals are a part of a family and a society, and therefore if you need to address their problems and solve them, we need to look also at family. Again, families could both be a source of the problem or also are inherently a part of solution to the problem that we are discussing. If you look at why the families, there are some genetic disorders which are obviously spread through the family. The other thing are many familial diseases in which the family members share similar behaviors and therefore are at higher risk of developing some certain diseases. This could be simple even for diarrhea, like washing hands. Many of these habits are familial because some families insist on that all members wash their family. So some of the habits that the individuals develop are dependent upon the environment in the family, and therefore you need to look at what the other members of the family are doing. Then, as I said, some genetic disorders. So there definitely we need to look at family as a potential contributor to the development of the disease. But more importantly, because we should focus more on solutions than only on the problems, because those are more or less difficult. Once the disease is developed, they may be less amenable to correction. But look at possible solutions to the family. Can we change the behavior in the family so that the individual is also more likely to change the behavior? We know that individuals change their behavior only if there is a pressure within the peers and within the family to change the behavior. This could be including even for smoking. If you want people to change their smoking habits, the family support and pressure is extremely crucial for this habit, leaving this habit. Then family, as we already discussed, of the important role of joint families in social support systems. Again, in trying to address the problem, we can definitely draw from a lot of resources which are available within the family. When resources does not mean only money, there are a lot of social support resources which are available in the family, which we should also not only identify but also try to use when we are trying to solve the problem. So whenever you look at family, again look at both sides of the equation, look at why families contribute to the development of disease, but also during your evaluation of the individual and the family, look at the pointers or indicators which you can use for solving the problem. One of the examples could be, again, like we talk of family planning and the role of mother-in-law in that, or say many of the child rearing practices, say weaning, breastfeeding. It is not only important to address when you are looking at solution at the mother of the child, but also to look at other elderly members in the family, whether it is mother-in-law, father-in-law or husband, and therefore look at the individuals not as a single unit, but look at family as a unit for intervention. And that is an important reason why you should study families rather than individuals.
Yeah, I think we are entering the patient, or through the patient we enter the family, or maybe we enter the family and then we highlight on each patient. So these are the two approaches. We will discuss in detail about these things in future teleconferences. But today I think we will only highlight on how to collect the data and what will be the sequence of all these events. I think the next is the dietary history. We have to focus more on this diet. I want every student to concentrate on the dietary history of the family or individual which I feel is very important and is not taught otherwise in most of the situations.
Yes. The role of diet, you see, basically plays an important role in any situation, whether it is an acute disease, it is a chronic disease, whether it is an under 5 child or a woman of the reproductive age, let's say between 15 to 49 years of age. Now how to take dietary history primarily. Most important is that you go by dietary recall method, that what the person has taken in previous 3 days. That is, we say that it is very good to have, some people say that it is good to have a recall of what they have taken for last 7 days, but if you have a very close rapport with the family, basically it is important, and you can go and visit them, the family is very open to you, then definitely if the mother is literate, she can also put in writing, if you are recording about the child, basically what the child has taken in morning, what the child has taken in afternoon, what the child has taken in evening. Similarly about her, but this can happen only where the family has time, the family has got good cooperation with you, they understand that you are basically meaning good to them. But certain informations are very important with regard to diet, whether the family is vegetarian or non-vegetarian. Now you will say that why should I take about history of vegetarian or non-vegetarian? Now if you have to suggest certain interventions, now let's say basically the person is suffering from coronary artery disease where lot of dietary modifications need to be made. So primarily we need to have information about whether the family is predominantly, or family is a vegetarian family or a non-vegetarian family. Now again, we got to take the details about the dietary items intake in context of, you see, the items consumed. And ultimately, if once we have a detail, as I said, if there is a diary basically which is focusing upon what the person has taken during each time. It is not only we are focusing about 3 meals, that is morning breakfast, afternoon lunch, or in the evening dinner, in between snacking, that means in between whatever the person has taken in form of biscuit or in form of samosa, or in evening you see some snack has been taken, because everything is going to contribute to the calories. Now if the child has taken, let's say, one, apart from breakfast, one banana at about 10 o'clock, that is also going to give you roughly about 80 calories. So ultimately we have to work upon that how much, you see, on an average, what is the caloric intake of the individual, and ultimately we also got to focus upon proteins. Though we say that in a balanced diet, calories, if we take care of the calories, then proteins will take care of themselves. But here we are talking of balanced diet. For this, you see, the total information, for the sake of simplicity, the columns have been spelled out in greater details in a practical book, and there will be no difficulty in recording this information. Now coming to the next column, that is environmental history, which has got a very important role to play on the phenomena of a disease, because wherever you see it is kacha housing, it is pakka housing or semi-pakka housing, each of them have got their influence on the course of the disease. What is the pattern of water supply, whether it is regular, irregular, it is from hand pump, it is from well, or it is in state of Delhi, it's a regular water supply through MCD. So it is very important to record that also. Now whether it is a shallow pump or because we are dealing with all variety of students which are from rural area, urban areas, urban slum areas, primarily this course is all about focusing at the country level. So here we want to see basically how, you see, the water supply also has got influence, particularly in diarrheal diseases. It has got an important role. It plays a very important role in terms of the habits which influence the family about hand washing and all that. So it is important that we record about water supply also in greater depth. Now second, this thing is also, the third component we'll see that it is about disposal of refuse and excreta. Now refuse is just a solid waste like paper, pencil, or you see it is a solid waste which is generated from the household. So how this waste is disposed of, whether it is disposed of indiscriminately, it is important to record that also. And what about excreta disposal? So all these have got bearing on health and disease, so that information is very important. So I will like Dr. Anand to focus upon these aspects before we go on to the healthcare seeking behavior and customs and beliefs.
Nutrition is definitely one of the most important things that you should concentrate while you are asking anybody you know, as a country, we are moving from primarily talking about malnutrition to asking about even overweight. And we know that these two can even occur in the same family. So the children could be malnourished, the adults could be overweight. And therefore, we need to also, in our thinking, move from only looking at insufficiencies, but also looking at eating more than what is necessary, a thing which Dr. Garg hinted before. When we are looking at, primarily earlier we have been looking mainly at calories and proteins, and as Madam said, if in a primarily a wheat-based diet, if you have enough calories, proteins take care of themselves. But now we need to also look at how much fats they are looking, and especially on salt. In the context of non-communicable disease, we also need to focus on fats and salts at least. There are important measurement issues when you look at diet. While it is very easy to, most of us feel that it is easy to take the dietary measurements, is actually one of the most complicated things to do, especially by just visiting once. If you want to estimate the dietary this thing in a house, it is going to be extremely difficult. But still, it can be done. We may never be absolutely exactly, we may not get the exact amount, but definitely we should be closer to that. You look at the frequency, it is not necessary that people, especially in rural areas, follow the same as breakfast, lunch, dinner. They may not have that kind of a pattern. And also, as Dr. Garg insisted, please look at snacking in between meals, especially in urban areas. You could have a lot of aerated drinks and snacks which are consumed during that period, with much smaller meals, and you may get a wrong impression of the total calories that they take. The next is the amount of food that they take. For a simplest example could be roti. You might eat, some people might be eating 2 rotis and some might maybe eating 4 rotis, but it does not mean that people who are eating 4 rotis are eating more than 2 rotis, because it just depends on the size of the roti. In rural areas, the rotis would be of much bigger size. They are up to 50 grams, even 75 grams. In urban areas, often they are between 25 to 30 grams. We have often seen students just taking some standard that each roti is 25 grams and calculate based on that. And often we see the gross underestimation of the calories that people take, and it is quite obvious that nobody could survive with that amount of calories that the person has taken. So you need to be sure that if you are using a standard sort of a table, that the students are, the families are actually taking only that much amount of. The simplest way is to find out how much atta they buy and see how long that it run and how many rotis are cooked in a day. That gives you a reasonably good approximation of the size of a roti. So you need to, similarly it could be katori. They might be eating 2 katori of dal. It is not that the katori of dal that I eat or you eat and the katori of dal that they eat is similar. The size of katori could be different, amount of water could be different, and both would drastically change the amount of dal that is consumed. So one should not take a shortcut and just apply a table and ask how much katori dal you take and you apply it. You need to do some sort of a estimation of the actual amount of raw materials that they take. And also for oil and salt, you need to look at extra oil and salt that is added beyond what that is added into the, because these are individuals. What is cooked is common for a whole of the family, but you are looking at individuals, you need to look at extra additions of ghee or makhan or salt which is there.
Yeah, I think we are having only 5-10 minutes more. So we'll quickly go through the other headings and we'll try to consider more on the summary and how to make community diagnosis, all those aspects. I will request Madam to spend some more time. So maybe you can quickly cover the customs, beliefs and other headings.
Yeah.
Okay.
Now the next component, if you will see on your table, basically is going to focus upon the healthcare seeking behavior. Now healthcare seeking behavior primarily is going to talk about that whether the family is visiting a traditional practitioner, they are visiting an allopathic provider, or you see they are visiting somebody from, you see, the system of medicine which may be alternative system of medicine like Ayurveda, Yuddha, Ayurveda, Unani, Siddha and all that. So basically that is important. Why it is important to look at utilization of healthcare seeking behavior? Because if there is no utilization and if we feel that the family, the child or a person needs to visit a formal healthcare facility where appropriate advice can be given, it is very important. Now another thing which is very important, particularly with regard to maternal and child health practices, also with regard to certain other diseases which are, you see, of chronic nature, it is important to look at customs and beliefs like child rearing practices, what was given when the child was weaned. That means weaning is a time when the child, gradually the breast milk is withdrawn and the child is put on alternative foods. Then what have been the patterns with regard to breastfeeding? It is exclusive breastfeeding, it is mixed feeding and all that. And again, you see, what all diet the mother takes during pregnancy. Are there any food fads which are present during pregnancy? It is important to look at that also. Now, what notions the family has with regard to family planning. So all these related practices are going to play a very important role with regard to customs and beliefs. Now, once you have obtained a detailed, you see, history, now go for general examination like you do a thorough examination in a clinical case. That means you are looking at pallor, you are looking at blood pressure, you are looking at pulse, you are looking at anemia, you are looking at edema feet. So all these factors are very important. And I will say that with regard to systemic examination, it is very important to focus from head to toe, so that you do not miss out anything in any particular system, but focus on that system in greater depth where the predominantly chief complaints are from. But it doesn't mean that if it is only respiratory system, that means there may be a case of malignancy of lung, or let's say, you see, there may be a woman who is recently undergone termination of pregnancy, so there may be related complaints of other systems also, but predominantly focus on detailed systemic examination. If you will look at, particularly we say with regard to under 5s, you do not miss anything if it is systemic examination in details. Now, laboratory findings. Let's say if there is a case of tuberculosis, then it is very important to focus upon. It is important in other, we do not say tuberculosis is just one of the examples I am talking about, but that doesn't mean that other findings are unimportant. Make your provisional diagnosis based on all those factors right from the beginning we have enlisted before. You see, that will give you a tentative idea of what the person is suffering from. Maybe you see the woman is suffering from infertility, maybe you see the child is suffering from childhood tuberculosis, the child may be suffering from malnutrition, and then you see, it may be very important to look at context, particularly if the child is suffering from, you see, the communicable diseases play a very important role, and there, you see, it is important to look at the context also, and we have to make a family diagnosis also. Now look at the, if you are focusing upon the under 5 children, then also we have to look at the child. Take the important anthropometric measurements which are given, you see, in terms of weight, height, mid-arm circumference, head circumference, chest circumference. But remember that when you are doing this anthropometric measurements, you remove the beginning of the tape part. So that means you are, because this tape is containing the metallic end, so always exclude that and start recording the measurements. So up till this point, it is very important that you would have arrived at a provisional diagnosis. Now, Dr. Anand, I will invite your basically inputs primarily as to how to arrive at a particular diagnosis with regard to all the information we have collected.
Once you collect all the information, you need to organize it in a way. Very often in your exam, you are just asked to start off with your diagnosis. And unlike in a clinical diagnosis where we just name a disease, in the social clinical case review, we expect you to give a diagnosis of the whole family, which in itself, that paragraph itself sums up the entire situation in not only the individual but in the family. You could look at, you should start off with, you can look at the way that we proceeded in this and start off with the type of family that you are, that is in case from a such and such family, is it a joint or a nuclear, what is the socioeconomic status of that family, and if you have some other particulars related to family that you would like to tell us, then those details. And then look at what are the health problems, not only in the case that you worked up, but also in the other members of the family. What were the health problems? You can list them, all of them. And remember, if there is an under 5 child, in this you have to talk about their immunization status, their malnutrition. If there is an eligible couple, you need to talk about contraception, what is the status there, whether there is any chronic disease in the family members or a disability or any addiction. All of these would be a part of the health problems. Then you look at the list of the social problems which are there in the family. It could be illiteracy, it could be poverty, it could be even some of the say female feticides or those kind of issues if we have picked up during these cases. So if you pick up some social issues, then also all of these put together, because these not only help you identify the cause of what we call as a web of causation, how this would have spread, but also look at possible areas which would help you in providing solutions when you come to the management of the case.
I think we'll spend some time, maybe 5 minutes in our next session on the comprehensive diagnosis and management of a family, because that is very important. That is what I want every student to learn. We'll end this session now. We'll be again meeting after 15 minutes, that is at 12 o'clock, and we'll, in addition to this discussion, we'll also take up how to work a project. I think we'll end here. Please be with us. We'll be back again at 12 o'clock.